Central line flushing and locking is an important process in maintenance of patency and protection of a patient's vascular access system. This presentation is divided into 4 basic procedures that are used for the maintenance of central lines. These procedures are preparation for the vascular access session, aspiration of the locked solution from the central line lumen, flushing the central line lumen before and after the vascular access session, locking the central line lumen until the next vascular access session. Please be aware that some procedures and products may vary depending on the type of central line in use. Always consult your institution's policies and procedures for the appropriate method to use for central line management and disposal of the materials after use. Gather all the supplies required to perform the procedure. Wash hands thoroughly, making certain to clean between fingers and under nails. Dry hands with a clean towel. Prepare the supplies on a sterile field. Put on a pair of sterile gloves. Assess the patient's insertion site for signs of inflammation or infection and the central line for problems such as cracks or line migration. Aseptically scrub the hub for a minimum of 15 seconds to disinfect the injection site. Allow the hub to dry for at least 30 seconds. Some procedures require that the previously instilled locked solution be removed by aspiration before flushing the central line. Attach a sterile empty syringe of the appropriate size to the central line hub. Open the clamp on the central line. Aspirate into the syringe to remove the locked solution and to confirm blood return. Close the clamp on the central line. Remove the syringe. Some procedures require that the central line be flushed with a normal saline solution prior to and after the vascular access session. Depending on your protocol, flush the central line lumen with a 10 or 20 ml prefilled syringe containing 0.9% sodium chloride solution. Remove the syringe cap. Pull the syringe piston back, then push it forward to expel the air in the syringe. Connect the syringe to the central line hub. Open the clamp. Flush the central line lumen using a start-stop pulsatile motion. While maintaining a positive pressure on the syringe piston, close the clamp. Remove the syringe. Repeat the aspiration and flush procedure for each central line lumen. Proceed with the vascular access session. At the end of the vascular access session, flush the central line lumens with normal saline as previously described. Locking the central line lumen is usually the last step that is undertaken at the end of the vascular access session. This step is performed in order to maintain and protect the patient's vascular access system until the next session. CitraFlow is a proven alternative to heparin locking solutions. Contrary to saline or heparin locking solutions, CitraFlow is an anticoagulant and antimicrobial locking solution that prevents central line lumen blockages and helps to reduce the rate of central line associated bloodstream infections. Unless otherwise indicated, central line lumens should be locked with the lowest possible concentration of CitraFlow. 4% CitraFlow is a safe and effective alternative to heparin locking solutions. There are no known side effects when using 4% CitraFlow to lock a central line lumen. 4% CitraFlow is available in 3 and 5 ml fills in a 10cc syringe for PICC line and port locking, and 5 and 3 ml fills in a 5cc syringe, single and twin pack for locking hemodialysis central lines. Before using CitraFlow, ensure that you have read and understood the instructions for use that are included with the product. Remove the syringe cap. Pull the syringe piston back, then push it forward to expel the air in the syringe. Connect the syringe to the central line hub. Open the clamp. Slowly, over an 8 to 10 second time period, instill the solution into the lumen of the central line. Instill the contents of the syringe, leaving only the last 0.1 ml of the solution in the syringe. Do not bottom out the plunger, as this could possibly cause blood to reflux back into the central line lumen. While maintaining a positive pressure on the syringe piston, close the clamp. Remove the syringe. Repeat this procedure for each central line lumen. In the event that a higher concentration of CitraFlow is indicated for use, proceed with the same locking procedure as 4% CitraFlow, except as follows. Instill the precise volume of higher concentration CitraFlow solution into the central line lumen as indicated by the manufacturer, adjusting for any additional solution required due to the use of valves or caps in the central line. Repeat the procedure for each central line lumen. The central line is now locked and protected until the next vascular access session. At MedXL, we are innovating for health.